Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Shall we turn to the front of the Mail and junior doctors planning 5-day strikes? It's been away from the front pages,
yes.
But it's not been away from I imagine, the minds of everyone working at the Department of Health.
It's been rumbling on, and there's a leaked document of plans that are going to be put out to vote. A vote of senior officials tomorrow about are they going to have these 5-day strikes or longer strikes. At the moment, there have been 24 or 48-hour strikes in the past. You know, there's two things in this. Nothing else so far has worked for the junior doctors. They are in a bind. The last thing they want is a headline of people who have died as a consequence of them going on strike. So they don't want it to have too much of an impact, but they want people to value the work that they do. And so they're having to balance it. I'm sure they are discussing all sorts of things. The question is, this has been rumbling on for so long. There is a lot of public support for junior doctors, but would there be, in the event of a strike like this, is there a finite amount of public goodwill for the junior doctors? I don't think they would realistically strike for 5 days in a row. It sounds like perhaps one option that was on the table, but if they did, I don't know how much goodwill would remain.
And they've got one huge flaw now, which they didn't have before in this great big PR fight, because it is all about the hearts and minds of the people, which is that their own board, their own management, the British Medical Association, has already cracked a deal with Jeremy Hunt, the Health Secretary. This strike should have been over, but the junior doctors themselves voted down their own union's deal. So that's a difficult one to explain, really, if you're a junior doctor, why it is acceptable to... The BMA do not lie down easily in front of the government. They've made that very clear. And a lot of people thought Jeremy Hunt met them, at least in the middle, if not further onto their side.
And the thing is also, there's an extra £350 million a week for the NHS, isn't there? So surely this whole thing could be solved just by, writing them a big cheque.
I do remember that the last time there was a 48-hour junior doctors strike, that the tone did slightly change, but they managed to get away with it by saying, look, patient safety will not be compromised. First of all, it seems strange to me that you can have a 5-day strike without patient safety being compromised. And if they can, doesn't that raise some interesting questions about just how many junior doctors we need?
It is a balance. I mean, obviously, what's happening there is there are consultants who are stepping in. There's a lot of sympathy within hospitals, in people who are in positions where they aren't junior doctors, but they will step in. Whether or not they would step in for 5 days is another matter. But it's a balance. How do you prove the impact of your work without endangering patients? They wouldn't want to endanger patients, but they want people to value them. And
also, of course, this is on top of the cluster of stories over the last month or so on the extra pressure the NHS is now under. The budget which it now has, which is an £8 billion more than it had last year, is yet again not enough. And services are now going to be withdrawn. We're soon now going to be coming across to autumn and then winter, and we will have another winter crisis hitting the NHS. And all this will, of course, help the junior doctors in their argument that the government doesn't fund it enough.
I've been getting away with it all